I want to talk today about the opioid epidemic that has gripped my state of Ohio and so many other states represented by members of this chamber. This is the #1 killer now in Ohio. It's surpassed car accidents. It's the #1 cause of death for Americans under the age of 50. And unfortunately, although some are saying we've turned the corner, we haven't turned the corner in a lot of parts of my state. In fact, there are areas of our state where we have more overdose deaths this year than we had last year, as tragic as last year was, being a big increase from the year before. And I do believe that here in this chamber we have made progress in passing legislation that's beginning to make a difference. I'll talk a little about that today, but I also believe we have much more to do. In the last couple of years, Congress has gotten busy on this issue. In 2016, we passed legislation called the Comprehensive Addiction and Recovery Act. It was the culmination of 4 years' worth of work, of conferences here in Washington, bringing some of the best minds from around the country together, looking at some of the best practices to say, how do you actually focus on this issue of the opioid epidemic in a comprehensive way? Because we know that's what has to be done. So it was about evidence-based prevention, strategies, about evidence-based treatment, about longer-term recovery. It actually was the first time Congress had ever passed legislation dealing with longer-term recovery. And that's because we heard so much testimony, me back home in Ohio, members from around the country, but also here in Washington from experts, about the fact that the chances of success when you go into treatment, particularly for this opioid epidemic, the chances of success are increased dramatically if you can have that longer-term recovery. Think of sober housing opportunities, for instance, after somebody comes out of treatment, to help get them on the right track. That bipartisan legislation I introduced with Senator Sheldon Whitehouse is now working back home. It's now going out to, again, programs that are evidence-based, proven programs to try to give them a little boost, working with local government, state government, nonprofits, and others, leveraging some of the federal money so that it ends up making a bigger difference to try to turn the tide on this epidemic. Maybe most importantly, this legislation, again, called the Comprehensive Addiction and Recovery Act, or CARA, maybe the most important thing about CARA is it recognized addiction as a disease. It was, in some respects, the first time we had done that as a Congress as well. And by recognizing it as a disease, it changes the way you view treatment, right? Because it's something that is not a moral failing. It is often caused, in fact, by an accident or an injury, somebody getting a prescription pill that changes something in their brain. They become addicted. But the point is, in order to solve it, in order to address it, treatment is the avenue that is going to be more successful. So treating it like a disease, I think, is one of the essential aspects of it. And also pulling away the stigma. Getting some of this stigma out of the way enables more people to come forward, get treatment, for their family members to seek treatment for a loved one, for doctors and others in the medical profession to treat people in a way that helps get them on the right path to recovery. So that legislation passed. And in fact, earlier this year in the bipartisan budget agreement, there was additional funding put aside for CARA and for other opioid programs, including one I'll talk about in a second, and that was very important. That 2-year funding bill provided $6 billion over 2 years, unprecedented. We've never done anything like that around here. So are we making progress? Yes. Are we there yet? No. The CARA legislation, in my view, was the right first step, but there's a second step now I think is needed, which is what we call CARA 2.0, Comprehensive Addiction Recovery Act 2.0. And it learns from some of the things that we have found out in the field as CARA has been implemented. It picks up some additional provisions. For instance, it talks about the need to deal even more substantially with overprescribing, because most people who die in your state or mine from an opioid overdose started with prescription drugs. That was their first opioid. I mentioned earlier people who might have an accident or an injury and are given opioids. We need to stop that overprescribing in order to get at the core of so much of this problem. Probably 8 out of 10 people in Ohio who overdose on heroin or fentanyl started on prescription drugs, sometimes obtained legally, sometimes not. But it breaks my heart to have a young person come to my office and say, I had my wisdom tooth taken out. This has happened to me fairly frequently because people know I'm focused on this issue. And this doctor gave me opioids, pills for a wisdom tooth removal. And in the cases recently in my office, it's been a young person saying, I was too smart to take them. Thank goodness. Be careful. And to the parents out there and the kids who are listening, be careful. Our legislation includes, by the way, CARE 2.0, a 3-day limit on prescription drugs for acute pain. Acute pain would be after a procedure like that, as an example. The dentists I know, including the new head of the American Dental Association, who has a passion for this issue because he's from Cincinnati, my hometown, and understands the impact of this. A lot of people I talk to say you shouldn't be using opioids at all in that case. When I had my wisdom teeth taken out, I wasn't given opioids, nor were probably many in my generation. And yet that seems to be normal today. So this is an example in CARE 2.0 to go even further, but in the meantime, we have the CARE legislation out there. It's being funded. That's a good thing. The other legislation is called the Cures legislation. That funding goes directly to the states and then delivered to various groups around the state, usually through the alcohol, drug addiction, mental health boards, ADAMHS boards. Some of you know about those. Some of you have probably been involved with those. That was passed at the end of 2016. It was passed as part of the 21st Century Cures legislation, which was broader legislation, but we made sure that opioids were included there. And I think some of my colleagues were working with me on that. There were so many, but Lamar Alexander, Senator from Tennessee, stands out as an appropriator and an authorizer who knew we needed to get some more funding out to these states, particularly states like mine and his that are so hard hit. Shelley Moore Capito from West Virginia, a state that probably is unfortunately number 1 now in terms of overdose deaths. Ohio's right behind, but another state hit hard. So many colleagues of mine fought to ensure that funding was in that legislation. It's making a difference as well. Last year, my home state of Ohio received $26 million, for instance, in Cures funding. Just recently, another $26 million that's being distributed now. So these two laws, CARA and Cures, are helping and encouraging innovative programs across Ohio. I've had an opportunity to visit a lot of these programs around the state. I've been to dozens of treatment centers and to roundtable discussions in communities to talk about how this funding can be used most effectively. And let me just give you a couple of examples. The week before last, I was in the Columbus area in a town called Whitehall. And I went to the fire station to have a roundtable discussion about this with community leaders and to see how their program called SAFE, S-A-F-E, is working. It's called the Safe Station Program, and it was made possible with a $400,000 grant through the CARA legislation. So this funding has been used to train up firefighters, EMS personnel, so they understand how to deal with the opioid issue, so when they have an overdose, they can help somebody go into treatment. This is really important for a couple of reasons, and this seems very simple, but unfortunately, there's a big gap right now in most of our communities. And I encourage you to plug into your own community to find out if it's happening in yours, because it probably is. And that is that someone who overdoses is now typically saved by this miracle drug called Narcan. And our legislation, CARA, provides more funding for Narcan. We need this. It's necessary, but it's not sufficient, because so many people overdose, are saved by this miracle drug that reverses the effects of the overdose. But then what happens? In the vast majority of cases, these people go right back to the old environment. Maybe to a dysfunctional family, maybe to a gang, maybe to just the old neighborhood. And if you talk to EMS personnel, firefighters, and police officers who are the ones responsible for usually finding these people and treating them, they will tell you they are not happy about giving someone Narcan again and again and again. They want to see that person get into treatment. It makes no sense for any of us, certainly not for the taxpayer. It also makes no sense for that addict and that addict's family and friends, employer, if there is one, because that person is not getting the help that he or she needs. So how do you close that gap? Well, they're doing it at this firehouse in Whitehall, Ohio. They're doing it in two ways. One, opening up the doors to the firehouse and saying, come on in. When I was there, actually, just by chance, a young man who described himself to me as a heroin addict, and he had heroin on his person. He had arrived just before me at this firehouse. Just by chance, he had come in off the streets because he felt like it was a safe place. He wasn't going to get arrested. No one was going to ask him a lot of questions, but they were going to get him into treatment. He said he was ready. Of course, I asked him, as I often do with addicts or recovering addicts, how many times have you been through treatment and what worked, what didn't work? He'd been through it 3 times already, and it hadn't worked. He said the difference now is he believed he was ready. You have to believe him. and you have to get someone in treatment when they are ready, and that's why having the doors of the firehouse open are really important. He was nervous, but he was being transported right after I had a chance to visit with him, and I got to see how these EMS personnel compassionately and professionally dealt with him. But he was getting ready to be transported to what's called the Addiction Stabilization Center in downtown Columbus, run by Maryhaven. Interestingly, CARA funded the fire station and their program. CURES is what made possible the Addiction Stabilization Center, $1.2 million in CURES funding in downtown Columbus, which is taking people from all over Franklin County and the Columbus area and making a tremendous difference of getting people not just through the Narcan and through saving their lives, but then getting them into treatment, getting them into recovery. And that's the key, closing that gap. It's tragic to me that that gap is so prevalent and causing such a problem around our state and our country. Anyway, the other thing they do, of course, at this fire station is when they have somebody who has overdosed and they provide Narcan, they bring them through this system and take them to Maryhaven Stabilization Center and get them the help they need. And it's worked remarkably well. Not everybody agrees to go, but the vast majority do. And that's a huge difference, again, from what normally happens in our country. It's an example of the kind of comprehensive program that is going to help close the gaps and catch those who are falling between the cracks. It's no surprise that the Surgeon General of the United States, Dr. Jerome Adams, said recently when he visited this program in Columbus, this is one of the best programs in the country for lowering stigma and enabling recovery, end quote. I appreciate the Surgeon General's involvement and his willingness to come to Ohio to help us and to see how these programs are working that we have passed here in the United States Congress. I've seen similar successes made possible through CURES funding and CARA funding around the state. Recently, I was in Summit County, which is in northeast Ohio. So we're going from Columbus, central Ohio, up to northeast Ohio. This is called the Summa Barberton Hospital. They have just received a grant from CURES, and they are using that for a pilot program to employ a full-time addiction care coordinator during the overnight hours and to ensure that there is medication-assisted treatment available at the emergency room itself. This had not been available previously. And what they're finding is somebody comes into the emergency room, typically, again, that person walks right back out the door after being saved by this miracle drug Narcan, also known as naloxone, and never to be heard from again until there's another overdose. And sometimes, by the way, according to the nurses, that overdose might happen as soon as the next several hours in the parking lot at the hospital. That's no solution. So what they're doing instead is bringing people in, sending them to a counselor. I got to meet the 3 women who are the counselors there, incredibly empathetic women who are taking these people in, saying, you know, no stigma here, no questions asked. How can we help you? Wouldn't you like to be back with your kids? Or back in a job? Or back in a place where you can respect yourself? And they've had remarkable success by saying, we can provide you right now, right here. In their case, Suboxone, which is a medication-assisted treatment program where you wean somebody off of a drug like Suboxone in order for them to get off their addiction and not go through the horrible pain of withdrawal, at least not as difficult a withdrawal. So they've had great success with that program as well. Again, closing that gap. I encourage you to look in your community for these kinds of programs and support them. They're also collaborating with the United Way of Summit County and engaging the business community to help with this issue. That makes me really happy. Every time I meet with business groups now, I try to raise this issue. So yeah, I'll talk about the importance of tax reform and tax cuts and regulatory relief, and all that's great. Our economy is picking up. But you know what? It is incredible. The #1 problem we have in our economy right now is what? Lack of workers. Every employer, small, large, medium-sized, are telling me, we need workers. There's a skills gap, of course. There are other issues. But I think the single biggest issue is this opioid epidemic, and that's based on a couple of studies, one from the Department of Labor, one from the Brookings Institution, which show that those who are out of work altogether, who aren't even applying for jobs, and by the way, among men, that may be at historic levels. About 8.5 million men are literally not trying to get a job. 8.5 million men between 25 and 55, prime working years. And you know what? Half of them say, 46% based on one survey, 44% another survey, and that's not over-reported. In my view, that's got to be under-reported because there is a stigma, there is a legal issue connected, but About half of them say they're taking pain medication on a daily basis. 2/3 acknowledge that it's prescription pain medication in one study. So this is a huge issue in the business community. It should be. If you want to have more workers out there who are ready to go to work, able to go to work, help on this addiction issue. Yeah, provide funding for some of these programs at work, but also dig into it in your community. Find out what's working, what's not working. If you have this gap, which I guarantee you do, between those who are overdosing getting this Narcan and those getting into treatment, address that. Find innovative ways to do it. If you're finding there's another gap between shorter-term treatment, say 6, 7, 8, 10 weeks, and then longer-term recovery, help address that. Encourage longer-term recovery programs. It can be outpatient programs. It might be residential programs, but we know that works to really get people back on track. Find out what's going on in your local community in terms of prevention. Is anybody going to the middle schools and talking about what a ruinous mistake this can be for your life to go down this path and to be careful about prescription drugs? If we don't all get involved, then we all have a reason to get involved, every single one of us, to ensure that people can live out their God-given potential in life, then we won't have done everything we can to try to reverse this trend. Again, what I'm seeing back home is that what we've done here so far is starting to work. I got to tell you, I believe that we would already be seeing a reversal and be seeing fewer overdoses across the board, if not for one thing. And that is the influx in the last few years, particularly, of this new drug. It's a synthetic form of opioids. It's not heroin. It's not prescription drugs. It's usually called fentanyl, sometimes carfentanil. But what it is something that a person made. Here's the shocking news. Fentanyl is 50 times more powerful than heroin, sometimes worse. It's very inexpensive. It's readily accessible. And it's coming not across the Mexican border, not, as far as we know, being made in this country. It's coming from overseas, mostly from China, and it's coming through our United States mail system. Now, let's be clear. This is the new crisis. Probably 2/3 of the deaths in my home state of Ohio from overdoses are now linked to fentanyl. We had a teletown hall meeting earlier this month, and the questions came in, and people were making statements and so on, and one guy called, and he wanted to talk about the drug issue, and he was very professional and very specific about what he wanted to talk about, and then toward the end of his comments and question, I could hear his voice crack. And I just knew something was up. And sure enough, he said, and by the way, my son died of a fentanyl overdose just a couple of weeks ago. He talked about how his son thought that he was just taking heroin, not that heroin isn't incredibly dangerous in and of itself. But the tragic story that Sam from Shelby County, Ohio, told me was that his son died of an overdose from fentanyl, and now his father was on the call trying to figure out how to get at this. He wanted to talk about the STOP Act, which is legislation we have introduced here in this chamber to try to at least stop some of the flow of this deadly poison into our communities. Again, we know where it's being made. We know where it's coming from. Law enforcement is desperate for some better tools to be able to stop some of this poison from coming in. We spent about a year in the Permanent Subcommittee on Investigation studying this issue. It's a subcommittee I chair, and we got some undercover folks involved with us to help us from the Department of Homeland Security. We were able to go online and find out how this tragic criminal network works. And we were able to access a couple hundred websites online that were happy to sell fentanyl freely online. By the way, we were able to trace the payment systems for people who had bought from these particular websites and therefore be able to track who was actually receiving these shipments. And we were able to find 6 different instances where somebody had actually gotten fentanyl from one of these sites, and then by looking at the local news, determining that person died of an overdose within a few days or a few weeks of receiving that shipment. So we were able to do this just by going online and finding out these people who had bought these drugs from these people, they themselves had died of overdoses of fentanyl. But think of all the thousands of others who had died who had received drugs through some of these criminal networks. And frankly, what we found as we looked into this deeper and deeper was exactly what you would expect, which is these traffickers are smart. There's a lot of money in this, and they know how to send these drugs into our neighborhoods, and they want to do it through the United States Postal Service. Why? Because the other carriers, think FedEx or DHL or UPS or private carriers, they are required by law, passed in the United States Congress, to tell law enforcement what packages are coming in, where they're coming from, what's in it, where it's going, through advanced electronic data before the package comes to this country. We required that after 9/11, frankly, not because of fentanyl, but because of the concern about people having other contraband, including explosives in packages. So we required all the private carriers to say to law enforcement, here's what's coming in, here's where it's from, here's what's in it, here's where it's going. With that information, law enforcement can then find suspicious packages, and I've seen them do it. I've gone to distribution centers in my state and been able to see some of these brave personnel from Customs and Border Protection. They are brave because some of this stuff is really dangerous. By the way, when they take a package in to inspect it, they have to put on a protective suit. They have to be in a room that's well ventilated so they don't overdose and die from some of this fentanyl that's coming in. But by knowing where it's from, where it's going, what's in it, and by having access to big data all around the world, not just the country, but the world, to know where the hot spots are, where maybe some Chinese company that has some evil chemists who are engaged in this, maybe they're transshipping it to another country, they find that out. If they see it coming from another country, they can find those packages as well. But they're remarkably successful at finding some of this stuff and getting it offline rather than having it go into our communities. But the Postal Service was not required to do this after 9/11. Instead, the Postal Service was told, you ought to study the issue because it's important and get back to us. We're still waiting for that study. That was over 15 years ago. So when you go online, what we found out is these websites are happy to send it to you through the Postal Service. In fact, they virtually guarantee delivery if you use the Postal Service. If you use one of these other carriers, they don't. That's sad. A United States government agency is being used as a conduit to ship poison into our communities. It's the #1 killer in my home state. So our legislation is very simple. It simply requires the Postal Service to provide 100% advanced electronic data to our law enforcement so they can do the job they want to do. Law enforcement is desperate for these tools, you can imagine. They want to stop this poison. By the way, the letter carriers I know, and you ask your letter carrier, they don't want to carry this stuff, and they certainly don't want to have this poison going into the communities that they serve. We have about 1/3 of the United States Senate now as co-sponsors of this legislation. Will it solve the entire problem? No. We talked earlier about the need for more prevention and education, treatment, to longer-term recovery. But at least, let's keep some of this poison from coming in. At a minimum, it's going to raise the price, which is one of our huge problems with fentanyl today. It's not only 50 times more powerful than heroin, and people chase that high, but it is very inexpensive relative to other forms of opioids. So my hope is that we will have this legislation on the floor in the next few weeks. We'll be able, in a bipartisan way, to deal with this issue and tell someone like Sam from Shelby County, I talked about earlier, who called in on the teletown hall, we are doing something so that the next dad is not going to have this kind of tragedy befall his son. By the way, 2 weeks earlier, had another teletown hall meeting. A woman called in, same thing. At the end of it, she talked about her brother who had died of an overdose of fentanyl that had been put in another drug. So it's being spread on not just heroin, not just cocaine, not just crystal meth, but other drugs as well. And that's one of the great challenges law enforcement has today. So, Mr. President, I appreciate the opportunity today to talk about some of the positive things this Congress has done. the Cures Act, the CARE Act, how I've seen it back home making a difference in the lives of the people I represent, but also need for us to do more. Certainly fund those programs, continue to provide the funding at these historic levels because it's necessary, because the epidemic absolutely deserves that kind of attention, and it's necessary. But second, let's take these other steps. Let's stop this overprescribing. Let's pass the STOP Act to ensure that we can deal with this fentanyl crisis. Let's ensure that we can turn the corner, turn the tide, begin to save lives. I think we can if we continue to make progress and continue to focus on these issues that make such a difference to our constituents. I yield back my time.